Welcome to Virtue Podcast, powered by Azka Pharmaceuticals, India's first company to bring evidence-based flat pricing in medicine. Virtue Podcast brings in renowned healthcare experts as we explore the path to healthier living, where science meets virtuosity. Tune in to YouTube, Instagram, Facebook, and Spotify as we welcome our virtuous guest. Don't forget to subscribe, hit the bell icon for the latest updates, and leave your comments.
Welcome to the Virtue Podcast series, where we decode the secrets of well-being with experts who truly care. I am Bhavin Bhatt, and today we have a distinguished guest, Dr. Rushikesh Shah, a renowned consultant with more than 10 years of experience in promoting holistic health at Zydus Hospitals, Ahmedabad. Dr. Rushikesh is academically very strong and has published many articles in national and international journals in his name. This podcast will be available on our Facebook page, YouTube channel, and Spotify as well. Welcome, Dr. Rushikesh.
Thank you for having me here.
Sir, moving right into the first question, what inspired you to pursue your career in medicine and how did you achieve your goal of becoming a doctor?
So, I mean, we all know that we have been going in and out of the doctor's office since our childhood, starting from pediatricians, and then as we grow old, we move towards the physician's office. The real change came into me, and in the depth of the subject and the field I came to know when I was about 13 years old. During that time, I had to undergo certain medical issues and conditions for which I had to take long-time treatment. And during that time, I got to know in-depth experience about the science behind it, the medical science, and also knowledge about the human body and the medical field itself. Right. So that was the turning point of my thought process and the timing to which I was slightly inclined towards biology and then my career towards science. So after completing my 12th science, I started to pursue my MBBS from Ahmedabad here itself. And after 5.5 years of MBBS with internship, I pursued my post-graduation in the field of internal medicine. And that was about 10 years back, and since about 10 years, I'm working with Zydus Hospital Ahmedabad as a physician over there.
That's a very interesting journey, sir. So, sir, what motivates you in your professional journey as a healthcare provider?
So, I mean, motivation comes day in and day out. Sometimes there are ups and sometimes there are downs. But to make a real tangible difference in people's life and to support them in their medical issues is one of the best motivation that one can get. Right. It is not just we being to treat them, but we being there for it in their difficult times. Right. And to see their expressions changing day in and day out once we see them during the whole course of the journey of their treatment is quite good and quite interesting. We see all the ups and downs of the patients when they come in, when they get admitted. Sometimes they get happy, sometimes we have to face difficult situations as well. Right. But the whole journey, the whole process, it's quite interesting and it is quite adventurous sometimes. Right. There is also continuous growth in the subject which you are practicing in. There is always the skill, the refinement as well. And you always continually grow as a person, as a professional, and you get to know many things day in and day out, and you have to be updated very nicely. Right. So what my personal experience or my personal growth as a profession would have been 5 years back, I'm much better aware of many things right now than I was 5 years back. So that keeps me going on for the patient care. Also, the biggest advantage that we get is the positive workplace atmosphere that we get while practicing as a doctor, especially in a corporate hospital where there are multiple specialties involved. Right. So we get to work in the team, and the teamwork we learn from each other quite nicely from different fields of specialties, and together we can make the difference in the patient's life. And it is not just me being an individual, but the best possible team efforts that we give and give the best outcome to the patients. That is the one thing that keeps me going on.
So it's all about the dynamism of day in and day out that you get to feel. you
Oh,
think?
absolutely, I would say. I mean, we as a team also, we have arguments, we have any things going on. Sometimes we agree on something, sometimes we don't agree on something. But eventually, what everyone does is do the best for the patient, and we think the best for the patient.
Absolutely.
And we might have different routes to follow, but
Yeah.
eventually we all want the best outcome of the treatment and the care that we give to the patients.
So, sir, having said that, according to you, what defines an ideal doctor and an ethical doctor?
Ideal and ethical would be a very questionable thing to answer. I would say ethical. I would say it's a very personal choice. I would for something for me, ethical would not be ethical for you, and something unethical for you would be ethical for me. So I'm not going to come into that question. But I would say some of the qualities which we get. What I would expect from myself or my colleagues would be, first of all, there should be compassion and empathy towards the patients.
Right.
That is the first and the foremost thing that we expect. The best thing that you can do is take time to listen to the patient and their families. Even if we just hear them for about 5 to 10 minutes, they feel very good and satisfied.
Okay.
So that should be, I think, one of the best things that the doctor can have. Second thing is that honesty and integrity towards the patient.
Right.
If we are very transparent towards the patient and their line of care that we are going to provide them, and make them aware of what is going to happen in a much simpler manner and in a quite transparent manner, then it becomes much nice for the patient to understand the disease and to get their cooperation as well.
Right.
A strong communication skill for the patient as well. If we are communicating absolutely everything to the patients and their families, they do build their trust on the doctors, which helps us to treat them in a much nicer way.
Okay.
Second thing, that we have to respect the patient and the patient's families.
Absolutely.
It is a mutual thing towards each other. If I'm going to respect a patient and their family, I'm going to get the same thing back as well. So
Right.
that is a quite a thing. And the most important thing is the patients and their families' autonomy. It is my role and my work to give them the best possible consultations and suggestions, but eventually what would come is the patient's autonomy. If the final decision would come to the patients and their family, I can try to convince them for a certain kind of a treatment, for a certain kind of a management or the therapy that can be going on, but eventually I have to give them all the options available, and then the patients and their families can take the final decision of their treatment.
Right. So, sir, with so much going on day in and day out in your life, how do you balance your professional life and personal life?
So, Bhavin, I would be really wrong if I say that I am been managing my professional and personal life really nicely, and it is actually quite difficult to organize things in a much nicer way, in a much fine-tuned way. But still, I try my level best to do that things. First of all, I try not to bring my work stress back home, and that plays a very major role. And so once I go back home, I try to keep myself calm as much as possible, and I try to get involved and invested with the family and the kids. So that is the first stress buster that I get, that I give myself after I go home. Again, finding the perfect right chord between the personal and the professional life, it's not 100% achievable, but still I try to balance it out.
So now let us focus on a very common disease, which is hypertension, or as we call it in layman terms, high blood pressure. So my question to you is that what is the role of artificial intelligence and wearable technology in enhancing hypertension monitoring and improving treatment adherence? Because today, these days we are hearing artificial intelligence technology is coming in everywhere. So I'm sure it has a role in medical field as well.
Correct. Over the last 10-15 years, we have seen the technology grow very rapidly in the field of medical science. Especially if you look at just one parameter, that is hypertension or high blood pressure, as you said. For blood pressure monitoring system, what we used to get earlier, we used to have sphygmomanometers, for which you need to go to a clinician's or a doctor's office, and there the clinician would put a cuff around your arm and then check with the instrument with accuracy. Then over a period of time, as the technology advanced and things progressed, we got our personalized home blood pressure monitoring instruments, the electronic instruments. And now the technology is more coming in and getting more concise, more precise. We are having other instruments which are still medically graded, approved, yet to be approved. We have the monitoring from the finger sensors as well. We have the monitoring from the wrist sensors as well, and smartwatches as well. Some of those technology are still yet to be approved and US FDA approved or the Indian Drug Administration approved, but still it is in the pipeline coming in. So these type of devices, especially what happens that if you keep on wearing them at home as well, you get the real-time monitoring throughout the day. The real-time monitoring eliminates the issue of the white coat hypertension, what we said.
Okay.
That if you go and see a doctor at your office, at his or her office, you have a tendency to have slightly high blood pressure due to anxiety or due to any other thought process going on. So that is completely removed. And these devices get as real-time accuracy at all the times of your day, throughout the whole day and night as well.
Right.
So it gives us proper and accurate measurements when the patient is in his or her own comfort zone. The AI part here is a very interesting thing. We get all the data analysis coming in, and it might help us to give us a personalized treatment plans which can be tailored to the patients individually. It cannot be a
Carpet
kind of a treatment plan for which would include everyone. If I'm going to start a certain medication for a patient, then I might have a reason that why I'm going to start a particular treatment for it.
Right.
The AI part would also help in the reminder of the medications as well, in having alerts and alarms just in case if there are any altered blood pressure levels coming in or any or any increased pulse rates or anything. So that also helps. There are also some multi-purpose instruments coming in which would help to monitor your blood pressure, your sugar levels, and your oxygen levels at the same time. And there are also sleep devices coming in which would help you diagnose the obstructive sleep apnea as well. So so all these instruments and all these AI platforms are going to be a much of help in the future. In the next, I would suggest in the next, I would believe in the next 5 to 10 years, these devices would really help. And the best advantage of this that the patient is directly involved in the part of the treatment, and the patient is directly aware of what is going on and what is not going on, and he or she can monitor his or her health and parameters very regularly on day-to-day basis.
Okay. So sir, how does resistant hypertension influence cardiovascular health, and what are the most effective strategies in its management?
Okay, so to understand resistance hypertension, first of all we need to understand what it is. So resistant hypertension is a condition where we use at least more than 3 or more class of drugs, and out of that one of the drug has to be a diuretic. Even despite these 3 drugs or more class of drugs, if the patient's blood pressure is not being controlled, we call it as a resistant hypertension. The most common thing that we usually see in resistant hypertension is the non-compliance by the patients. If the patients don't take their medications from time to time, or if they're very irregular, sometimes they take, sometimes they don't take. That is the most of the common reasons we usually see. The other common reasons that we usually see is taking of painkillers. And painkillers like NSAIDs, the most common thing, and ibuprofen or diclofenac, aceclofenac, such kind of painkillers which are easily available over the counters. So these are the medications which also cause this resistant hypertension. The side effects of this issues and the side effects of this resistant hypertension. The kidneys are one of the most common things that get usually affected. Kidneys can go dysfunction and can cause chronic kidney diseases. And the number of hypertension medications in a chronic kidney disease patient keeps on increasing. It also affects the heart in like 2-3 ways. There are increased chances of having coronary artery diseases. There are more chances of getting atherosclerosis. So those are the things that would affect the heart and its functioning. and in the layman terms, the pumping of the heart goes down. So those are the common things that we usually see. There is also risk of cerebrovascular accidents like a stroke, you would say. So these are the common side effects, and stroke is one of the most common thing that happens during if you get resistant hypertension, and that and the blood pressure is persistently on the higher side. Now, to reduce and what can be done to control the resistant hypertension, first of all, we need to get the best compliance out of the patient, and we need to make sure that the patient takes his or her medications from time to time and daily and regularly.
As prescribed.
As prescribed, yes, absolutely, yes. The patients do not have to change the medications dosing by themselves.
Right.
That has to be very strictly instructed. And the second thing is that optimization of the medication should be nicely done and aptly done. That will also help. We also have to rule out the secondary causes of the hypertension, like renal artery stenosis or pheochromocytoma, or the newly diagnosed things such as like obstructive sleep apnea. These are the very major causes that are hidden and underlying. There are dietary changes also that we usually suggest. Sometimes DASH diet as well. DASH diet has less of salt intake and more of fruits and vegetables and green related diet, which helps to better optimize the blood pressure as well. Regular exercise and physical activity is a must thing to help the patients optimize their blood pressure, and frequent monitoring and frequent follow-up of the patients to the doctors whom they are going to follow and treat is a must thing, so the doctors can optimize their blood pressure in the best possible way.
So Dr. Rushikesh, ongoing research suggests that there is a relationship between the gut microbiome and blood pressure regulation. So what is your opinion? How can it be a potential new treatment approach?
So as you said, Bhavin, that the research is still going on. We still do not have sufficient data or sufficient studies which can prove that gut microbiome is a part to regulate the blood pressure as well. There are certain things that I would like to share, that gut microbiome does release some kind of short fatty acids which helps in the blood pressure control and management. Also, the gut microbiome has nervous endings, sympathetic nerves which ends in the system and which is directly linked to your blood pressure. So any imbalance in the sympathetic nervous system cause fluctuations in your blood pressure as well. Plus also imbalance in the gut and chronic inflammation in the gut also has a tendency of having stiff blood vessels. This is still under research, and the stiff blood vessels and the arteries can cause increase in the blood pressure.
Point of view for gut microbiomes, certain prebiotics and probiotics might help and beneficial in for the better blood pressure management.
Second thing, dietary changes like low salt intake, dietary contents like yogurt, curd, buttermilk, which helps for a good gut health. Those might be the contents which might be helpful for a better optimization. And certain drugs like short chain fatty acid mimicking drugs might be in the pipeline, which may eventually help in better control of the hypertension.
So considering Indian society per se, what are some common misconceptions about hypertension and how can they be effectively addressed?
So it's a very good question that you asked. In the Indian scenario and Indian setup, where there is always this tendency of jugadu, the patients and the public have a tendency of not accepting that they are having blood pressure.
Right.
So the common misconception and the common myths that we usually see, that if a patient is young, a child, or in their 20s, they would not have hypertension. But hypertension is such a condition that can come and cause at any age. It may be because of any reasons. Recently there has also been an increase in the tendency in the late 20s and early 30s as well, because of the youngsters' lifestyle and their sleeping patterns and addictions and everything. But yes, at any age the condition of hypertension can occur. Both males and females are equally impacted. The males being slightly on the higher side, the chances of having hypertension, but it is not that the females do not have hypertension. Third thing, that this disease is not the disease of the rich only. It affects the urban population and the rural population, both the ways. There is slightly higher tendency in the urban population. Almost one third of the urban population is suffering from hypertension, and 1/5 of the rural population is suffering from hypertension. But it is equally prevalent in both the rich and the poor and the middle class family as well. Another thing, weight issues. Weight has directly no connection with your hypertension. Okay, if you may be obese, if you may have a high BMI, that does not mean that you are going to have hypertension. Even the lean and the thin and the normal BMI people can also have hypertension. So the weight also does not have direct connection to your hypertension. Or like if a person is obese, then he or may she not have always hypertension. The common myths that we usually see, that if you're not having symptoms of any hypertension, then you're not having any hypertension. So it is not necessary that you will have symptoms when you are having hypertension. There are silent hypertension symptoms as well, which you might not realize. Only regular blood pressure checking through your doctors and the clinicians can only diagnose that if you are going to have it. Second thing, that if you just in case if you are diagnosed with hypertension, and if you stop eating salty foods, stop eating oily food, and stop eating heavy food items, then your hypertension is going to be normal. That is not the case. Yes, your dietary changes will help to control your hypertension in a much better way, but it is going to completely cure it is not the case. You might still require some sort of medications. Another thing that we usually hear from the patients, that once your blood pressure medication has been started, it will go on forever. It is not the case always. Once your blood pressure medication starts, there is always a tendency that we might be able to reduce it, but sometimes in some cases we are also able to stop it. But the patients have to be very compliant with their lifestyle, their dietary habits, their physical activities, their exercise, and have a very strict life work balance and proper sleep pattern. Then yes, we are able to step it down. Some patients and some people do not take hypertension medications, considering that the medications will have side effects. Okay, but they have to understand that by not taking hypertension medications, you are causing more problem to yourself. So keeping your blood pressure under control is a very necessary thing, and you should follow your doctor.
So this is all new perspective that you have given today, and I think I'm sure this will help a lot of patients and population at large to manage and monitor. So now coming to the last but not the least of the questions of this podcast, that what is that one key message you would like to convey to your patients regarding hypertension management and overall health?
So my advices to the audience would be that after the age of 30, you should get your regular blood profiles done and complete health checkup done, just to make sure that everything is okay. And just in case if you are suffering from any comorbidities like hypertension, you should be regularly visiting your doctors for the follow-ups, and you should be keeping track of your vital parameters and run the blood tests as well. Make sure that everything is normal. Your daily routine exercises, your physical activities, and your dietary planning should be going on, so that all the comorbid conditions are up to the optimum level. A regular monitoring would be the best thing that one can do for themselves, and just keep a check on them. Another important thing that I usually suggest my patients, that they do not change the treatment or they do not stop the medications without asking. Doing so can decline things further or make a bad impact on your personal health. And one more last thing to say that I tell all my patients is good hydration, good nutrition, good exercise, and good sleep. These are the 4 things which can improve on any comorbidities or any chronic health issues, because a patient's health is a journey, and in that every steps are going to be counted. And if a cordial relationship between the patient and the doctor is always going to be there, and together they can make the patient's life much better in their daily routine activities. So just be in regular touch with your doctor.
Indeed, sir, this is very, very insightful, and I must thank you for enlightening all our viewers, patients about the better way to manage hypertension. Thank you, Dr. Rushikesh,
Thank you.
for taking out time from your busy schedule.
Pleasure.
We truly appreciate your patient-first approach. We trust all viewers will get benefited from your virtuous tips to live a healthy life. Thank you once again.
Thank you.